with Dr. Christopher Carpenter, who is a pediatrician at Natividad Medical Center. Dr. Carpenter is going to talk a little bit about what questions parents have about the COVID vaccine, the upcoming COVID vaccine for children. He'll also be part of a town hall that the county is co-sponsoring tomorrow night, which will be streamed here on Facebook and on one of our media partners, KION 546. Thank you, Dr. Carpenter, for joining us today. Can you start by telling us a little bit about what are the kinds of questions that the parents are asking you about vaccine in children?
I've been getting quite a few questions, both from patients and from members of our community at the hospital. Many of them revolve around the side effects, both the common side effects and the more rare side effects. And then I get a lot of questions about the research that has gone into the vaccines, the research globally for the vaccines, and the research that has gone into vaccines for our kids ages 5 to 11 and the 12 to 15 years range. I would say that's probably the most common questions I get from parents.
And how do you respond to the, I mean, I'm assuming that those are pretty common questions. As a parent, that's something that we would all, ask an expert. How do you respond to those questions?
I try to figure out where they are coming from. What do they understand? What are their major concerns? What are their worries? I like to find out what it is that is concerning them. And then I'll go from there and try to have a dialogue with them. I found that if I try to be too doctory or preachy or give too much data and research, that oftentimes I don't connect with the families or the parents. And I ask them if what kind of data they would like, and then I can provide them at the level that they are seeking.
So we're anticipating a lot of questions from parents tomorrow night at the town hall, and you've also done a webinar with one of our local school districts as well. How did that go, and what can people look forward to in terms of the type of questions that people ask and then the type of responses?
I had a great webinar last week with the school district. There were many engaged parents and had great questions. Had questions about the philosophies of vaccines, about the research, and about implementing the vaccines in our communities. And we were able to talk about some of the foundational research in the vaccines, that this vaccine has been researched for many years, even before COVID was even known. And then we talked about the research that has gone into this particular vaccine for adolescents and children. And we've got good data for our kids 5 to 11-year-olds, and we have excellent data for our kids 12 and older. So we were able to go through some of that data. We covered some on the surface, and then we dove into the details of other. And then we talked about the side effects and what to expect with the COVID vaccine. And we got into the nitty-gritty details about concerns about inflammation of the heart, a very rare side effect. And we talked about what could potentially happen with those side effects and the course of illness that those children have, which recovered fully from their myocarditis.
So in your practice and in the parents that you talk to, do you see a trend where parents are interested in getting the vaccine, they're more hesitant, or they want to wait and see, or they're not interested? Kind of what are you seeing?
I see the full spectrum. There are many parents that are very eager and first in line. I will say I am a parent of a 10-year-old, and based on the data that I have seen coming out for the 12 to 15 age group and the recent data for the 5 to 11 age group, I will be first in line at my clinic to get the vaccine for my kids. But I definitely have parents that are really engaged in understanding. all parents want to do what's best for their kids, and they want to understand and they want to make an informed decision. And I think that is fantastic to have that dialogue. So when I have a parent that is skeptical about public health or vaccines or the medical system, I want to engage in a dialogue with them so that we can work through this together and come to a conclusion that is best for their children.
Is there I know your time with us is short today. Is there anything else you'd like to tell us about the vaccine? Anything else you'd really like to emphasize or share with parents?
I really want to emphasize that there has not been a vaccine that has been more rigorously researched and tested over the last year and a half than COVID vaccine. Tremendous amount of effort from federal, state, agencies has gone into making sure that this is going to be safe for our kids. And I have tremendous confidence in the research that has gone into this vaccine. And I think it's going to really help us emerge from this pandemic and be able to get back to normal.
Thank you very much, Dr. Carpenter, for taking some time today to talk about this subject and for participating in the town hall tomorrow night. I'm looking forward to hearing your answers myself.
Okay, great. Thank you. And I wanted to say thank you to Dr. Moreno for leading us through all of this. And he is a fellow pediatrician, so I'm proud to be on his team.
All right. Well, that's the best lead in ever to our next. You're hired. On our communications team. Thank you, Dr. Carpenter. And as described, our next guest is Dr. Moreno, our public health officer, who is, I don't know if you've got an update for us today, or we'll just take questions.
Hey, good morning or good afternoon, Mayor. I'll go ahead and take questions today.
All right, thank you. So I've got some questions that were sent in advance, and I'm going to go ahead and start with those. If you have any other questions for Dr. Moreno, go ahead and put them in the chat now, and we'll get to those as soon as these are completed. So our first question for you, Dr. Moreno, the numbers for those Monterey County eligible residents who've received at least one dose of COVID-19 vaccine is 83%. While those eligible and fully vaccinated is 75%. But those numbers remain unchanged from last week. Why is that?
So thank you, Mayor. So we round off the percentage of individuals that are eligible to receive the vaccine who've gotten at least one dose. We round it up. So we have at this point, every week we have more and more people getting vaccinated. But if the total from one week to another does not round up to the next digit as a percentage point, then it stays the same. But the numbers are going up every week. It's just, we just will round it up, and when we get to that point, they'll change. But we are, through the vaccination efforts of our pharmacies, our healthcare providers, public health, and others that are providing vaccinations, we are making strides every week.
Thank you for that. And I noticed that we've had a couple of weeks where we've had somewhat no change in the overall number, but then the following week we moved up. So that's likely to be the case as we continue, correct?
Yeah, that's correct. So if we may be at in one group or one population, we may be at 76 for 1 week and 76 the next week. We might actually be from 76 1 week and then we're 76.4% the following week, but we haven't gotten to the point where we can round up to 77. So we'll stay at 76 until we can get closer to 77, then we'll put 77, just as an example.
Thank you. The next question for you. The FDA advisory panel has approved the Pfizer vaccine for children 5 to 11 years of age. How many other steps need to be taken before shots can be given to that age group, and what are they?
Oh, that's a good question, Maya. So once the advisory group to the FDA makes their recommendation, which they have, the FDA will consider that, and the agency head will make a determination based on recommendations from the advisory group and recommendations from her own staff, what the final authorization will be. Again, these are emergency use authorizations, meaning that given if there's enough evidence through the manufacturer's own clinical trials and other research that's being done throughout the world, to show that the benefits outweigh any of the risks, which was just briefly mentioned, risk of side effects, If those benefits outweigh the risk, then the FDA will come out with its emergency use authorization criteria. The next step is that the advisory group to the CDC will then take up the data, the research, the outcomes, and consider the recommendation of the advisory group to the FDA. And then they will make a recommendation to the CDC. And then the CDC will come out, the CDC director will then come out with guidance for clinicians and vaccine providers and for the general population as to who may receive the vaccine. In this case, we're looking at the 5 to 11 age group and specifically the Pfizer vaccine. And then here in California, there is a Western States advisory group which advises the health departments of, I believe, the 4 Western states, which include California. And then the California Department of Public Health will issue its own recommendations. So it's with those steps, those are the steps that are required for vaccine providers to have benefit from the full recommendations from at the federal level and the state level prior to offering vaccine to individuals, children ages 5 to 11. So in terms of, I guess the question that's lying in there is when it will be the earliest the kids can start getting vaccinated. I don't know when that'll be, but I anticipate that it won't be much longer.
Thank you. Next question, how eager are parents to get their children vaccinated as soon as the Pfizer vaccine becomes available for that age group?
Yeah, so another good question. So I don't know that I can answer specifically the question how eager parents are, but I can look at information that we have on another pediatric age group, and that's the children ages 12 to 17. And we made pretty good progress in a short amount of time vaccinating children in that age group. So what that requires is that the parents provide the consent to have their children vaccinated. And I think that looking at the data, about approximately 76% of children ages 12 to 17 in Monterey County have received at least one dose. So I think there's quite a bit of enthusiasm for that age group, and I'm sure a lot of those many of those parents not only have kids between the ages of 12 to 17, but probably have kids between the ages of 5 to 11. So hopefully they'll continue to have that enthusiasm to protect their children and get them vaccinated as well. And getting the vaccine for our children is very important because one of the goals besides trying to protect our health system and not overwhelm hospitals with children who are sick or severely ill with COVID, we're also trying to keep kids in the classrooms. So by vaccinating our children in schools, it will decrease the likelihood that a child is going to come down with symptoms of COVID and have to stay out in isolation, and also decrease the number of exposures and cases in schools, which also reduces the number of kids who are in quarantine. So very good reasons why parents should consider vaccinating their other children in the 5 to 11 age group when it's available.
Thanks very much, Dr. Moreno. Next question, what is your assessment of Monterey County's current hospitalization rate and test positivity and case rates? And are you pleased with the relatively low numbers?
We're definitely working very hard together, public health, healthcare providers, and businesses and community at large to try to slow the spread of COVID-19. We are seeing a decrease in positivity, which goes along with other statistics that show that the transmission has been declining over several weeks now. And so that's a very good sign. And also our hospital numbers have dropped down. I think the highest we got here in Monterey County in this most recent surge was, I think, about 50 individuals hospitalized with COVID. And now we're getting much lower than that. So, and the trend is that it still seems to still be declining. So that means that not only are we seeing decrease in transmission, we're also seeing the decrease in cases, which go along with that. And then after we see a decrease in cases, we see a decrease in hospitalizations. And then finally, we usually see a decrease in fatalities once we start seeing that fewer people are being hospitalized with serious illness.
Thank you, Dr. Moreno. Next question. Is it certain that COVID-19 cases and hospitalizations will increase in Monterey County during the periods around Thanksgiving and Christmas?
Ma'am, we do know that last year around this time we started seeing a little bit more people getting out of their households and mixing with people from other households. But we also have fewer people vaccinated during the holidays last year compared to where we're at now. And so we do know that the holiday seasons do provide opportunities for people to come together from different households. And we expect that that's going to happen again this year. The difference is that more people are vaccinated than this time last year, which does help provide some protection. However, the data that has been coming out that still shows that people who've been vaccinated can still get COVID. They won't be as sick, they're less likely to be hospitalized, but they can still get COVID after being vaccinated, and which means that they can spread it to other people. So it'll still be important during this holiday season for people who plan on traveling or planning on visiting friends or relatives from other households to continue to do their best to, as much as possible, keep their events outdoors, as much as possible, to maintain some distance and wear face covering, especially if they're around people who haven't been vaccinated yet, like children or people for whom the vaccine is contraindicated. And try to do our best to continue these efforts to try to reduce the spread of COVID, so we hopefully won't see an increase in cases or during the holidays, or if we do see an increase in case rates over the holiday seasons, it won't be as the increase won't be as great.
Thanks, Dr. Moreno. Next question, how long can we expect Monterey County to be stuck in the low 80 percentile for vaccination coverage, or at least one dose, among the 12 and older residents?
All I can say is that we continue to make progress every week, Maya, on vaccinating individuals. I think there are some people who are still hesitant to get the vaccine. And hopefully, as we continue our outreach efforts, our educational efforts in various languages to inform and educate and encourage vaccinations, some of those people who have been putting off getting the vaccine will eventually get the vaccine. And we'll see the benefits of getting the vaccine to protect themselves, protect their friends, protect their people they work with, and eventually get the vaccine.
Okay, thank you for that. And this appears to be our last question for you. So if anyone has any additional questions, go ahead and put them in chat. Dr. Moreno, can you outline what the side effects are, both common and uncommon, for children ages 5 to 11 years of age?
Certainly. So the reports from the manufacturer and those doing the clinical trials in the 5 to 11 years of age group did share that the most common side effects are similar to the side effects that were experienced among those ages 12 to 17 and young adults, which was primarily redness and soreness in the injection site. Also headaches, muscle aches, and chills were the most common side effects. And those were, but they were typically mild to moderate side effects. They weren't more serious, serious side effects were uncommon in that age group.
Thank you, Dr. Moreno. That is the last question that I have in chat, and I don't see any more. Are there any last questions for Dr. Moreno before he steps away from the call? If not, that's all the questions we have for you, Dr. Moreno. Thanks very much for joining us today.
All right, thank you, ma'am.
I'm checking to see if Javier Vanga is on the call with us. He is our next speaker, but I am not seeing his name. So I'm going to try to get a hold of him. And in the meantime, we're going to go over, we've got Commander Daryl Simpson from the Sheriff's Office, who I'm going to call you a little early and hope that you can give us some tips for parents on Halloween safety, because it is that time.
Good afternoon. Thanks for having me. Yeah, a couple of tips, just kind of common sense. Remember to have your children and yourself when you go out to use the crosswalk. Walk, don't run. Use pathways, sidewalks, and try to stay as far left facing traffic as possible. Try to implement reflective tape or glow sticks into the child's costume. The parents may want to outfit themselves with the same and have flashlights readily available. And remember that during these times of COVID that we want to trick or treat outside when possible. We want to do it in small groups, keeping our social distancing. To remember that when you see a small group at a door, instead of compounding it and sending your small group up to it, wait till that group clears and moves along before you send your children up to the door. If you're going to be handing out candy, possibly think about doing it from outside, maybe even setting up a table and putting prepackaged goodies out for the kids to take themselves. If you're going to be driving tonight, although the prime hours for trick-or-treating is generally between 5:30 and 9:30, don't wait until the sunset to turn your headlights on. Turn them on early, slow down at intersections, and give a little bit of extra time at stop sign, stoplight, or any intersection to make sure there's no children present. Enter and exit driveways a little bit slower. Get rid of distractions, whether you're driving a car or walking children around. Put your cell phone down and keep your head up. Stay alert, take a little bit of extra time, make sure the kids are walking, not running. Again, driving a car, slow down and stay alert. You're dealing with children that are very excited. They're going to be apt to make some mistakes and possibly run out into traffic or get away from their parents or adults that are supervising large groups. And just be safe and take every precaution. And as much as we want everybody to have a good time, the most important thing is that everybody gets through this having fun and being completely safe.
Thanks very much. And it's always good to remind people, even if you think it's common sense, it's always a good reminder because it's Halloween and everybody's pretty excited.
Yeah, and I would say that, like I say, that even though people generally start trick-or-treating after work, there's always groups that are out a little bit earlier. So as a common rule, just on the 31st, knock a few miles per hour, especially in residential areas, off of your speed. Just take that day and decide that you're going to turn your headlights on every time you get in the car and go a little bit slower that day.
Thanks very much for this advice. Great advice. And are there any questions about Halloween safety for Commander? No? Okay, thanks very much for joining us. And I was still trying to reach our guest who is having difficulty connecting. So we're going to save that particular topic for next week and we'll loop him back in then. So if there are no other questions, that'll wrap up the media briefing today. We'll see you next week.